right. Well, thank you. Thanks very much for having me. Well, it's great to be with all of you today. When I authored the bill, actually that was at the time in which we were essentially shutting down Healthy Families and rolling it into Medi-Cal. And one of the things that I talked to the Department of Healthcare Services at the time was that while children may be, in terms of financially, 20% of look at the director so you can correct me if I'm wrong, of our Medi-Cal spending. So you think about it, it's 50% of all the children, roughly, about half of all the children that are actually covered by this program. So I know one of the questions people brought up is, well, what's going on in terms of single-payer proposals? When you think about it, half the children are funded in this state by Medi-Cal. And so that's why, to me, as a pediatrician and as a father, why it's so important that we have a panel like this, because we need to be sure that children who are not just little adults, children have a voice, and that we have people who are going to advocate and look at the particular needs of children who often get lost. Because they said, even though we're half of all the children in the state, most of the money in the Medi-Cal program is spent on very important things, other things. So, but I think it's important that we have people who are looking at specific needs of children, that we don't simply say, well, we have a system we designed for most people and adults, and then we just simply apply it for children directly, and that we look at the particular needs of children. So that's why this panel is so important, and your work is so important to the state of California. And I appreciate being here and appreciate your service on this panel. And I also want to thank Director Kent for being present as well. I understand that you regularly attend the meetings of this very important panel. And so I want to thank you for your commitment to children. Now, I think there were several different issues that you wanted me to comment on here. One was about possible Medicaid changes. If you actually happen to know what they are going to do, let me know. I think if there's anything that we can say about what's happening at the federal government is that in this era is that we're not sure what's going to happen. And frankly, we have a president who says lots of things, and we're never sure which one he really means or he's going to carry through on. He did say that he was going to have a alternative to the Affordable Care Act that was going to cover everyone. Yet he supported a proposal that was going to decrease coverage. He said he was going to leave Medicaid and Medicare and Social Security intact. But yet the proposals, of course, were going to essentially block grant in some form Medicaid and put other limitations to Medicaid. So now that specific proposal failed, but it's hard to say because whatever is said doesn't necessarily seem to translate into the actual actions that happen later on, or at least proposals at this point. So in terms of possible Medicaid changes, I would say is that I agree with what the governor has said is that what we can't do is chase our tails, and until they actually change something, I think we assume we keep moving forward, all right? And because unfortunately there's just we're not sure what proposals to take seriously or not. So I realize that this isn't really an answer to your question, but if you have an answer, I'd love to hear it as well. So we're all struggling with that. I do think, though, it's important that we speak out, though, and that's something that I've been urging people to do because people need to hear about how important the program is. A lot of times people don't really know what the Medi-Cal program and how important it is to so many people in California. It's not just that other program for the poor. It is mainly targeted at low income, as I said, half of all children. So it's an extremely important program for children. In terms of state single payer bill, obviously it's still I don't think it's still I don't think it's even been heard yet in committee yet. But I mean, fundamentally, the biggest issue has always been dollars, right? And where the funding would come from. If we think about our Medi-Cal budget overall right now, it's over $100 billion. And most of that comes from, a good chunk of that comes from the federal government. So if we're concerned about what the federal government's going to do with Medi-Cal funding, with their share, if you think about it, it covers a third of all Californians. We said half the children. Take that, and you're looking at something that's going to be around, $250 to $300 billion. So if you simply sort of triple up so exactly where that money is going to come from is the big question. So I'm sure there'll be, people always back and forth talking about it, but whether there's the political will and also the funding available is uncertain. Actually, in my mind, the problem is, just saying single payer, it's the details that matter. So, and I would point out again, for children, we do have kind of a quasi single payer system because half of all children are in, and what we got to do is figure out how do we make our existing single payer system, Medi-Cal, work better. And that's part of what you're here to do as well. As far as the prospects for CHIP reauthorization, I haven't heard a lot of news about saying that Congress isn't, but I haven't heard about it. It is. So I think certainly there are groups out there who are pushing for that. I think that a lot of states do depend on that as well, that funding. So exactly how that's going to shape out to cut health care for children is not particularly a popular thing to do. And so it'll be interesting to see how that plays out. But there hasn't been a lot of noise about that I've heard. And so, again, I'm going to be cautiously optimistic and say that it is going to get reauthorized. Again, we haven't heard a whole lot about that. But certainly if it's not reauthorized, that's going to create, a significant amount of pain for both the state, for the children of California. So that's something we definitely want to keep an eye on. In terms of federal immigration and immigration issues, actually, in my mind, one of the biggest challenges we're going to have in regards to the tone around immigration that's happening is really about the fact that you're going to have families who, and people, including children, who qualify for programs, including Medi-Cal and food stamps and CalWorks and so forth, whose families, because even if the child is born in the United States as a U.S. citizen, the families who may have members who are undocumented are going in hiding, and they're not going to be applying for these programs. So we can have a program, and in fact, here in California, we're funding not only, of course, Medi-Cal for people who are documented, but also a state-funded program for children who are undocumented. Given the tone and rhetoric around immigration, a lot of these families are essentially not afraid of applying for government services, and afraid that is going to become the way that immigration is going to go find them and then deport family members. So I think one of our biggest struggles is actually going to be what do we do when we have an increasingly large population of people, families, and their children who are trying to access those services and the benefits that come from those services. And I think that's going to create tremendous challenges in many of our communities because if you don't have access to health care, not only, of course, does your own child or other members of the family delay care until eventually get sicker if they have a contagious disease like tuberculosis or something. They're not going out to seek care, then you're going to have spread of diseases such as that. You have children who are not able to perform well at school because they're hungry or they aren't getting dental care, right? And that's going to inhibit their education and then their opportunities. So those actually, to me, are probably the bigger issues regarding immigration. I know that some people have been concerned about, the threats from the Trump administration to deny funding because if we become a so-called sanctuary state or sanctuary cities and so forth. The Supreme Court has ruled in various cases that it's not the duty of the state or local governments to carry out federal laws. And in fact, there is a constitutional separation. So to compel the state to enforce federal immigration laws is actually constitutionally suspect, especially if it has nothing to do with immigration. So providing health care service, anything that's non-related to even law enforcement or immigration itself directly would be questionable for them to say, well, we're going to withhold health care funding because you're not, your sheriff is going out to enforce our immigration laws. I mean, that would be very problematic. So, in fact, I think the Supreme Court has ruled in various cases that's especially an unfair taking actually from the state. So, certainly that's going to be an issue that there's a lot of rhetoric about. If the federal government tries to act on that, I'm sure the state, through our Attorney General, will push back on that through the courts. I think there's good case law to say that we would be successful in that. So I think the real challenge, though, is the fear factor that's generated among families. As if you have, and you can't stop. On one hand, we don't have to help enforce immigration law, but it doesn't stop the federal government from sending agents in and intimidating people or walking around the streets and so forth. So I'd be more concerned about families just not wanting to access services because of fear about possibly having to deal with the immigration officials, even with protections we might put in place. I think just that general fear is going to be a challenge. So I think those are some of the issues. Obviously, it's a time of great uncertainty. In some senses, the uncertainty is good because it means that people are also pushing back. People are recognizing that we need to push back on some of the more draconian proposals, and that we need to protect the gains we've made in getting expanding health care coverage for everyone in the state and across the country through the Affordable Care Act. If you saw the most recent census data that showed that especially states that implemented the Medicaid expansions have also been able to cut their number insured significantly. So we need to continue that progress, and but more importantly, actually, in many senses for our state, as we embrace the Affordable Care Act, and we have reduced the number of uninsured, not that we can't do further work there, we also need to make our existing systems work better. So now they have Medi-Cal. While we may be concerned what happens at the federal government, we need to make our Medi-Cal program work better. And so that's part of what I hope that all of you will work on. We have our CCS program, be sure children with special needs get the care they need. We have better coordination of care. How do we better? We look at social determinants of health. How do we coordinate across not just the healthcare delivery piece, which is what Medi-Cal, but how do we coordinate across mental health, developmental services, social services? Think about how that whole system of care comes together and what role Medi-Cal can play to help bring that together so we can provide better quality care as well as more cost-effective care. So that's, I think, the continuing task before this body, and I appreciate all your efforts in doing that. And again, thank you so much for having me here. Thank you.
I'm going to open up public comment to the phone. Operator, if there's any public comment that would like to speak at this time, please let us know.
First comment is from Christy. Your line is open.
Hi there. This is Christy Colbert-Burchett from Educate Advocate. And we serve families who have children with special needs. Primarily, those that we serve are low income and on Medi-Cal. And one of the problems, besides having an adequate network, a Medi-Cal network of providers, is, the quality of care, having enough providers who are, willing to take the Medi-Cal rate. Recently, a service was restored in July of 2016 for acupuncture, but of the two companies that I've queried, IEHP and Molina, IEHP is using a third-party organization, ASH, American Specialty Healthcare, and they have terrible Yelp reviews, as far as the services that they offer. And Molina isn't even caught up in offering acupuncture yet to those who have Medi-Cal. So those are problematic areas. The other issue is chiropractic care was never restored back to the budget, only acupuncture. The other point I wanted to make was, since the passage of SB 277 and we have people who want to get medical exemptions, and they have Medi-Cal. There are just very few limited providers, medical providers, who actually will write a medical exemption letter. And part of the issue is that they get substantial funding for making sure that they have all of their patients up to date on their vaccines, as opposed to they would not get the funding that they would like if they have patients that they have to write a medical exemption for. So there's very few, because there's no financial interest gain to be made there, offering a medical exemption letter, and that's very problematic. So I wanted to bring these to your attention and hope you will consider these for an item on your next agenda. Thank you.
Next public comment from the phone.
Our next comment is from Christina Hildebrand. Your line is open.
Hi, this is Christina Hildebrand again from A Voice for Choice Advocacy. I would like to just second what the previous woman just said, and my comment was, from a mental health perspective, there are lots of ways of treating mental health. There was talk of, psychiatrists and obviously medication to deal with mental health, but I would ask that you look for, when you're looking at different ways to also include alternative care. So things like, the acupuncture, the chiropractic, the sort of different avenues, different forms of therapy, different forms of other types of healthcare, things like food and nutrition that play a big role in a child's body and their needs and their mental state, that you sort of take a holistic approach when you look at what services are being offered, and not just go with sort of the traditional psychiatrist or even psychologist, but when you're looking at medication being provided and services being provided under Medi-Cal, especially because in my experience, in our experience, it usually sort of goes to the medication much too soon, because that's the easy route out of it, or the easy Band-Aid to put on it. And so I would just ask, in your conversations, in your discussions in the future, that you look at the child as a whole, and things like food and nutrition and other options that are not medication, which can have long-term effects, are looked at and are considered. It was a comment that I was going to bring up, if it hadn't been brought up, was the preventative care of mental health, and ensuring that we stop it where it starts or before it starts, and we identify that, because the number of special needs children, and mental health isn't necessarily always a special needs, but it sort of goes into that grouping. It needs extra care, I guess, is where it comes under, is growing in the state of California, and our budget just cannot support the way it's exponentially growing. So I definitely ask that the committee definitely look into that. The other piece that I would ask is that, one of the things that has become evident in this legislative calendar is that home visiting is being pushed more and more, younger and younger. And I understand that would be a way to look into and do more preventative care, but I would ask that you look at the least restrictive and the least invasive way of doing that preventative assessment, and it not necessarily being done with home visiting, because that is an intrusive way of doing it. So to look at other options, or the least invasive way to do that preventative care. That's my comments. Thank you.